Hello, my name is Stephen Lewis. I am the Associate Director for Graduate Admissions and Recruitment here at the University of Indianapolis. I want to thank you today for joining us for our Masters of Science in Athletic Training webinar. I also have with me today an admissions counselor, someone you probably have grown familiar with if you are working through or have questions about our program and application, Michelle Ferguson. I also have with us today the program director, Dr. Jessica Juncom. So I'll go ahead and I'll turn it over to Jessica, and we'll get the webinar started.
Well, hello, and thank you, Stephen, for introducing me. Welcome all of you to our webinar. And today, what we're hoping to do is tell you a little bit more about the athletic training profession, and then specifically more about the athletic training program here at the University of Indianapolis. So I think it's real important that we just all start on the same page as far as what are athletic trainers. And so athletic trainers are highly qualified, multi-skilled healthcare professionals. And we're going to work with physicians, and we're going to help provide those preventative services to help prevent those injuries. Should those injuries occur, we're going to be trained in the emergency services to provide that emergent care. Once we're there on the scene or in a clinic, we're able to do an evaluation. Particularly, we specialize in orthopedic care, but we're also trained in injury or illnesses as well. And once we decide, what's wrong with somebody, then we can start working into those therapeutic interventions. Therapeutic interventions include that rehabilitation, so therapeutic exercise, as well as the use of modalities. So we work under the direction of physician and as prescribed by state licensure throughout 49 of the 50 states. So when we start looking at what do athletic trainers learn in order to provide athletic training services, we're going to have classes that are going to touch on all of these domains of athletic training. So injury and illness prevention, as well as promoting in wellness, examination, assessment, and clinical diagnosis, again, particularly to orthopedic injuries and some illnesses as well, immediate and emergency care scenarios, therapeutic interventions, and then healthcare administration and professional responsibilities. So the field of athletic training is very broad as far as professional settings. And so most folks are aware that athletic trainers work within educational institutions. So some of you might be familiar with the athletic trainer that works at your high school. We're also starting to get into many middle schools as well. And athletic trainers are employed through colleges and universities through helping with athletics. Again, most people understand that athletic trainers work with professional and amateur sports organizations. So you might see us on television, say on Sunday afternoon, watching NFL games. Also, you will see us at the Olympics and all other professional sports. In the area here, we're looking at, say, all of our area universities and our professional sports as well. Beyond that, you're going to find athletic trainers that are employed in different hospital and hospital-based clinics. So outreach athletic trainers might split their time between a school and a clinic. You might also find athletic trainers that work directly at the clinic 100% of the time. So those would be all outpatient services, particularly working with the active population. Another area that encompasses a clinical setting are athletic trainers that work directly with physicians. So the physicians will use an athletic trainer with the patient to help gather patient history, help to kind of expedite the evaluation process for the physician in an orthopedic setting. And then the athletic trainer and physician will work together for a diagnosis, perhaps order imaging, perhaps get that person fitted for crutches and a boot and some home exercise programs. And then some athletic trainers will actually work with their physician, if they're a surgeon, in the operating room as well. Athletic trainers are also working with the tactical athlete. So the tactical athlete setting includes all branches of the military, particularly at the largest military bases. And locally and different spots regionally, athletic trainers are also being employed to work with municipalities with their police and fire departments. Here in Indianapolis, The Indianapolis Fire Department is provided healthcare through athletic training services, and soon contracts will be developed with the Indianapolis Police Department and other regional police departments and fire departments around the city. Athletic trainers are also found in the performing arts. So if you look here in the city of Indianapolis, Butler Performing Arts, IU Performing Arts, all have athletic trainers working with them. If you look broadly, all Broadway shows have athletic trainers, large ballet companies do, as well as, a lot of people are familiar with, like, say, Circus Olay, and those acrobat athletic performers. Drum Corps also has athletic trainers that are employed with them. Athletic trainers also work in the industrial setting. If you think about, again, where active populations work, the industrial setting is a very demanding job setting, and that's where athletic trainers can be on hand to help prevent an injury from occurring through the use of ergonomics. And then should an injury occur, the athletic trainer would be there for an initial evaluation, and then the ability to take that person and help rehabilitate them through therapeutic exercise to return them to work. So locally, Subaru, Monarch Beverage, Cummins International, Rolls-Royce, Eli Lilly, all employ athletic trainers. So as you can see, it's a pretty broad job field. So what you're probably worried about is how to become an athletic trainer if you're interested in our degree program. So the first part that you need to do is to complete your undergraduate degree. And your undergraduate degree needs to make sure that you've got the prerequisites in place to apply for our program. All athletic training programs are going to require prereqs in chemistry, biology, anatomy and physiology, stats, physics, kinese, exercise physiology, nutrition, physics, and psychology. That would be standard across the board, and again, very similar to what other healthcare professions are requiring. Next would be the location and selection of a CATIE accredited master's program. This is a professional program in which is accredited by the Commission on Athletic Training Education. So all programs need to be accredited. Once you successfully graduate and complete your master's degree, then you're eligible to sit for the National Board of Certification exam. This exam is the gatekeeper exam in order to be able to practice as an athletic trainer. And then once you become a certified athletic trainer, then you need to obtain state licensure. And that would be varied on which state you end up practicing in. But the board certification exam is what is needed in order to obtain your state license. So now let's talk specifically about what makes the UIndy Master of Athletic Training program unique. So as I mentioned, I'd like to introduce you to our faculty. So I'm Dr. Jessica Emlich-Jocham. I am the program director of our program, and I teach a variety of our classes, particularly the Intro to Athletic Training course, which happens in the summer. I teach the evaluation course for all of the illnesses, organization, administration, and leadership and management. So a lot of those administrative skills that fall into that fifth domain of athletic training. Areas of research that I enjoy is interprofessional education. I work on several collaborative projects looking at the prevention of youth sport injuries, and I also dabble in a little bit of Pilates research as well. I am completing my 4th year here at the University of Indianapolis with a prior 14 years of experience in higher ed. Dr. Stacy Gavin is our clinical education coordinator. So she helps to arrange all of the clinical education rotations that students have. She teaches our emergency procedures class, and I like to say she teaches any class that requires movement. And so that's where you can start looking at her therapeutic exercise class and her applied kinesiology class. Her Foundations of Intervention class also helps build that foundation of knowledge when it comes to the evaluation process for orthopedic assessment. Areas of research that Stacy is looking at is chronic ankle instability, vestibular rehabilitation following concussion. She also studies soft tissue mobilization, and she's currently working on a research project with colleagues in the exercise science program as well. Dr. Cam Powden is our latest addition to our faculty, and he teaches those evaluation courses that are so important. So he kicks off his teaching with the Applied Clinical Anatomy course, and then teaches our lower and upper quarter evaluation courses. He also teaches therapeutic modalities, practice issues in athletic training, and psychosocial interventions. Cam's classes are very dynamic in nature. All of our classrooms have treatment tables in them. So he'll lecture and then break right into lab, and then lecture and then break right into lab. So students are learning and then doing and applying right away in all of our classes. We have a very interactive and dynamic course structure. Areas of research that he enjoys is chronic ankle instability and studying the effects of manual therapy and movement. So let's talk a little bit about the highlights of our program kind of by the numbers. So as I stated earlier, it's real important. The board certification exam is a gateway in order to be an athletic trainer. So the University of Indianapolis Master's Program has a 100% first-time pass rate on the board of certification exam. That's an important number to know, to understand that we are preparing our students to pass the exam. So in our program, we implement several benchmark exams. They're non-punitive, but at the end of each semester, students are tested on the knowledge that they've had thus far in the program, so that when students sit for the board of certification exam, it's not the first time that they've actually sat down for a large computerized exam. We also have a course in the last semester of the program that helps students develop their study plan, test strategies, and really working on the review of the exam. And we also pay for a board of certification exam, practice exam for each student to, again, help ensure that they are well prepared for that very important vacation. Our program also currently has a ratio of 7-to-1. As I mentioned, we have 3 faculty members, and we currently have 20 students in our program. And so that means that students, although we are a larger university, students still have that same small school experience. It's really a nice blend of what some students would be familiar with if they went to a liberal arts college where everyone knows your name, but we also have the same benefits of larger universities. And the fact that we're located in Indianapolis also stretches ourselves to a wide variety of clinical rotations. So because we're in the city, we have 60 different preceptors at 40 different locations, all within the Indianapolis metropolitan area. That really allows us to have a wide variety of settings, and then also help be able to customize that clinical rotation schedule for those students to really help meet not only their educational demands, but some of the things that they might want to focus on for their own specific career goals. So again, if you look at it, we have a variety of settings, a good faculty-student ratio, that we can really start working with students to customize what that clinical rotation schedule might be. Additionally, what makes us unique is that we offer 3 immersive rotations. Immersive rotations you can kind of think of almost like an internship. And that's where the student will be at their clinical rotation the same amount of time as their preceptor. So the preceptor works 8 to 5, Monday through Friday. That's when the student would be there. So the immersive experiences have been proven to show that it'll help the new clinician enter into the workforce better, because you've been there all day, every day, learning the ins and outs of the administration and communication, and really becoming a part of that organization. So we have the first immersive rotations at the end of the first fall semester, and that would be at an area high school for 4 weeks. The second immersive rotation is at the end of the first year, and that is held in the summer, anywhere between 8 to 12 weeks, depending on the setting and the student. And then the last immersive rotation is during the last 8 weeks of the program. And that is really designed to help the student be in a great setting to help launch them into the job force. So each of these, we work with our clinical education coordinator, we work with the sites, and we work with the students to really try to customize where a student might want to be placed. So what happens in those classrooms? I mentioned that it's really interactive, and we need to make sure that you get all of that content that's important for being an athletic trainer. So everything is going to be, it'll start with our clinical rotations. So you're out there learning outside of the classroom in clinical practice with one of our 60 preceptors at one of our 40 sites. And then in the classroom, we're going to have a blend of lecture, and then that's all going to be combined with lab. So as I mentioned, we've got a lot of interaction and a lot of dynamic learning that happens in our classroom. We have longer class periods, which really allows for good critical thinking and practice time. We also learn through simulation. Simulation is where we are able to simulate different injury scenarios to allow the students to learn in a safe environment. So one of the examples I can provide you is for Interprofessional Education Week, I partnered with our friends in nursing, and we did a simulation where the students came across a patient that looked like they might have overdosed on illicit drugs. And so our students had to react to that situation, come in and provide emergency care. So that would be doing an evaluation and establishing respiratory care, activating 911, waiting for campus police and EMS to arrive, while maintaining all the emergency care that the patient needed, including administration of Narcan and maintaining airway and whatnot. Then through the simulation, our EMS partners with Midwest Ambulance arrived, and the students had to report the case and then ride back in the ambulance back to the UIndy Hospital, which is our simulation center. It's a full simulation center with high fidelity mannequins, and care was then transferred over to the nursing students. And so then the nursing students provided the care in the hospital setting. So this allowed collaboration with the two professions. Athletic trainers got to observe nursing students, and nursing students got to observe athletic training students. So it's a great simulation. So that would be a large one. However, we do much smaller simulations on a regular basis as well. The other tool that we use to teach are what are called standardized patients. Standardized patients are where we have actors that are given a medical case, and they portray themselves as a patient the same way for every student that comes in. So we use, again, the simulation center where it's recorded, and the students walk into a patient case, and the actor goes through the evaluation with the student. So the student will ask questions, and the actor provides a prepared response. These are then videotaped, and then the student watches those for reflection and submits a reflection, and then the students will all come back together for a debriefing. What went well? What didn't go well? What do we need to learn from this situation? And the nice thing is that it's a standardized patient, so every student had the same experience. We can control that learning environment, where clinical rotations, every day is different at every setting. You're not always all going to see the same thing. So we really feel that a combination of lecture, lab, simulation, standardized patients, all centering around our clinical rotations, helps develop an athletic trainer that is well prepared for clinical practice out in the setting and ready to practice at the top of their scope of practice for athletic training. So as I mentioned, those clinical rotations are really important. And because we're in the city of Indianapolis, we have a wide variety of clinical sites. So you can see right away that we use the three major healthcare providers, so Community Health Network, St. Vincent's, Franciscan, and IU Health, for a lot of our clinical sites. For the clinic-based, we also have the opportunity to work with 3 different universities. So we use not only our own University of Indianapolis athletics, but we also have preceptors and clinical site at Butler University and Marian University. So again, this provides a nice variety of different university exposures. We also used a company named Pro Team Tactical, which is the company that is employed through the city of Indianapolis to provide medical care for Indianapolis Fire Department. So again, having an experience with those tactical athletes is wonderful. We also have affiliation agreements with our 3 professional teams in town. So the Indy Fuel is our local hockey team, Indianapolis Indians is our local minor league baseball team, and the Indy 11 is our professional soccer team in town. We also have a great relationship with the NFL Combine, which comes to the city every year, where our students are able to go in and assist with patient history and other tasks that might need help with the Combine. We teach all of the basics that are required for athletic training in our classes, but we also want to make sure that our students are practicing at the top of our practice act. So that means that we're also teaching IV administration. We're teaching wound closure through suturing. We're teaching tourniquet care for any kind of large, massive bleeding. And then we're also stretching ourselves into various rehabilitative tools. So some of you might be familiar with functional movement systems, FMS, or Y balance training. We also are strong base in manual medicine. So looking at instrument-assisted care, such as Graston, and cupping techniques, just to mention a few. Every student in our program will also have the opportunity to complete a research project. These research projects are done in groups, partnered with faculty members, and they will be completed with the graduation. And so each of our faculty members have varying interests in research, and the students will be able to help select from a list of research projects. And then we'll work together. Each semester, the student gets credits towards working towards a research. Currently, our research products, so at the end, will be worthy enough for and have been accepted for national presentation at various national conferences, including the National Athletic Trainers Association, the Physical Therapy Combined Sections meeting, the ACSM, American Academy of Sports Medicine National Conference, as well as regional and state conferences. Most projects will also produce a manuscript that will be worthy enough to be published in any of the medical journals. So these are high quality projects that are done over the course of the 2 years. As you can see here, we have a wide variety of titles, and this is currently what we're working on with our students. Another unique aspect to our athletic training program is our ability to really connect our students with the leaders in our field. Again, being in Indianapolis really helps. Our faculty are very well connected in our networks, that we've really had great opportunities within the last year to bring in some really great folks to speak to our students. So just in this last semester, we were able to have the past and current president of the National Athletic Trainers Association come into campus to speak to our students, as well as the executive director of the National Athletic Trainers Association. We also had recently this semester the president of the World Federation of Athletic Training and Therapy come in and speak to our students about global opportunities in athletic training following graduation. We had the district director of the GLATA, the GLATA, as well as the president of our district. So that's our regional districts were also on campus this past academic year, and the president of the Indiana's Athletic Trainers Association. We feel that interaction with the leaders of our profession is a foundational level of significance for our students. Our students need to graduate here understanding the profession and the role that they can play in all of these professional associations, as well as how important these professional associations are for them as future clinicians. I'd also like to point out that we have an Athletic Training Student Association. The Student Association is recognized by the university and has provided funding. And so we are able to offer monthly meetings and guest speakers, as well as this organization helps provide mentoring between the two cohorts. So second years and first years are paired up to help provide some academic and moral support. They also host different social gatherings, and then they also have funding from the university available to help support travel to all of those professional conferences that I mentioned. So my goal as a program director is to make sure that students in our programs have the opportunity to attend state meetings, our district meetings, and national conventions with some financial support from the Student Association. So if there are any questions, I'd be more than happy to answer them for you. And please note that you can reach out to me. All of my information is on our website, Dr. Jessica Emlich, Jocham, as the program director. And I'm more than willing to help you navigate this big decision to select an athletic training program. Thank you for your time.
Thank you, Dr. Jacob. Again, if you have any questions at all for any of us, you can reach out to us, particularly if you have any questions for admissions. Michelle Ferguson can definitely make sure she gets that squared away. If she can't answer, she'll make sure to find the answer. Her email address is Ferguson, Ferguson, MJ, at UIndy.edu. Again, Michelle Ferguson can take care of that. Any questions that you may have. We definitely appreciate you taking the time to learn more about our Master of Science in Athletic Training. And we would love to see you on campus in June. Thank you.